Hey, I was asked in one of the comments if I could narrate what I'm doing in some of these videos that I made, and I'm going to explain. I'm using a dentorum plier. It's a bird beak, small bird beak. It really helps make these wires super tight, the loops. It's almost impossible to bend if you have a crappy pair of pliers. I'm using a 0.18 wire for these guide wires. And what they're used for is basically to stabilize the wraparound expander. If you don't have these guide wires, the patient will tweak the wraparound in all kinds of different directions and are almost impossible to get back to its normal shape. But with the guide wires, it's going to keep them very stable. Some other names besides guide wires that you might have heard for these, some doctors call them stabilizing wires. Some call them eyelet wires, some call them circumferential wraparound support wires. I like to mark the wires and bend with a 3-prong. Basically, I'm just contouring the wire to fit inside the pallet with the 3-prong. In case you're wondering where's the best place to place these wires, it's really up to the doctor's discretion. There's really no right or wrong place. Some people like to put them. Some doctors will ask if you can place them on the distal side of the first bicuspids. I've also had doctors ask if they can put them in between anterior teeth. So there's really, it's up to the doctor's discretion. Now, one thing you'll notice in this video is I actually do the left-hand side, and it's good to pay attention because when you're making those little spindles, the loops to go around the wire, they're actually the opposite direction, so they're not the same. If anybody's wondering, this concept of wrapping a wire is the same technique that I use when I'm wrapping my thicker wires to make rest. In the video above, this was a true story, and it scared me to death because this could happen to any patient before I learned to wrap the wires. So this video is extremely important. If you didn't get a chance to watch it, there'll be a link at the end of the video. Please watch it. It could save someone's life. One thing about making YouTube videos is what the audience doesn't realize. Sometimes I go a little bit off camera. The camera moves. It's basically because I have, believe it or not, I have a tripod hanging above me, lights from different angles. Everything's in my way, so it's really extremely hard to make these videos. One of these days I'm going to actually demonstrate, show you how I'm making them, so you'll have a little bit more of a realistic approach why some angles are bad. So again, I emphasize the eyelet is actually backwards on the left-hand side. I'm sure there's a lot of people who skipped out on the video and said, oh, I know how to do this, and they're going to put their eyelets backwards. But for you that watched the video, you're going to learn and master this technique. If you like these types of videos, please leave me a like and share them. That would be awesome. It helps the channel grow. And we will see you in the next one.